everything is curable. We're in a new era, remembering what the earth has been whispering, shifting from conventional medicine's quick fixes beyond prescriptions. This is our journey back to the intelligence of the body. Welcome to Beyond the White Coat. I'm Gaya Stepanian, your host, and you are watching Beyond the White Coat, where we return to the Earth's natural medicine, restoring health through nature's original blueprint. Beyond the White Coat is for truth seekers, for those who wish to understand the human body beyond what we've been told through conventional medicine, and to understand how our body can truly heal. Now, joining me today is a wonderful physician who practices more on the holistic side, but has been a clinician for 30 years. And he has really been able to fuse these two forms of medicine, from the conventional to the holistic, to provide optimal care. That at the end of the day, let our ethics be our guide. Let our compass be our heart in providing and delivering the best possible care to patients. I know that as a healer, it's important that that also be our compass. Yes? So, Dr. Justin Newman serves as medical director for the Banyan Holistic. He's a physician and an innovator, and he specializes in functional and holistic medicines, including acupuncture, Chinese medicine, and Reiki. He's also an Aikido instructor. He certifies people in Reiki, and he provides consultation to corporations, to government agencies, to educational institutions, to professional organizations. And he also offers free consultations on the phone and on Zoom around the world for those who want to learn more. So, need I say no more? Joining us here is Dr. Justin Newman. Welcome.
Great to see you. Thank you so much. Thank you so much for having me.
I'm so excited about this conversation that we're going to have about how we can bridge these two medicines, and also, why do you think some people are turning away from conventional medicine and looking for the holistic? What's going on in that formula? I know I have my perspective, but I would love to hear from you.
Just thank you for asking. This is an important subject. I'm glad we're covering this. Trust and confidence is being slowly worn away in the relationship that our patients are having with their doctors, family doctors, specialists, people they've worked with, or relied on for a long, long time, and that trust is being worn away. There's a lot of rabbit holes that we could go down, so I'll try to keep this relatively streamlined. I think it boils down to one thing in particular. Doctors that are working in the mainstream or conventional space don't have enough time to explore at the root or original level where are their clients, where their patients' symptoms are coming from. They're busy treating or managing symptoms as best as they can, and they're limited on time, they're limited on resources, they're limited in their education. So they don't have a lot to work with except what's being provided to them by way of medical school, education, and that framework too is being worn away. Did you know, one rabbit hole, doctors today are given fewer classes in nutrition, fewer, which blows my mind. Part of the other problem, besides not having time to research at that root level, is managed care. Now, there's a lot of good that comes from having a health insurance and having managed care, a healthcare structure to work within, except one of the downsides is that this managed care structure that most doctors are working in provides specific protocols that these doctors have to follow. And on one hand, it's good because it limits risk, or it limits liability or negligence in their practice. So it's good that we have those protocols to keep us safe as patients who are receiving or trusting in their the medical know-how of the providers that they're seeing. But there's not a lot of wiggle room. For example, there was a virus, and the virus is spreading worldwide, and we're looking for help everywhere we can get it. And for years and years, people may have turned to vitamin C or other forms of support to help boost up their immune system. And all of a sudden, there's only this vaccine therapy that people can get. Now, whatever side of the argument you fall on in terms of that approach, every other way that we would treat vaccines, your immune system, or treat viruses disappears. I think patients are knowing, to boil this down, that their doctor's hands are tied. There's not a lot that they can do. They don't have a lot of options. And they might mention prescriptions. They might mention specific tests. They might mention certain next steps, but only within these protocols that they're given. And doctors are, from what I can tell from a physician side, not just from what I hear from patients, they are worried about working outside of that paradigm. Their doctors are worried about moving outside of their protocols because they themselves don't want to be found negligent or liable for doing things that their managed care organizations or their healthcare medical supervisors are telling them to do. And it is frustrating because I think patients know that there's a lot that can happen with diet, exercise, stress management, getting right sleep, hydration, sun, vitamins. There's a lot that we can do on our own, meditation, etc. But our doctors aren't saying anything about that. All they're doing is trying to manage symptoms, hopefully as best as they can, but using a prescription-based methodology. And it's just falling short. And patients are looking for where else they can get that information, but it's not coming from their doctors.
Dr. Newman, I mean, it's not just falling short, because medical error is a third leading cause of death. So somewhere in this whole, strategy or structure, I believe, created by the pharmaceuticals and by the insurance companies, and maybe they're all in the same, people are getting sicker. The more people are prescribed meds, in my experience, from what I see with my clients, those clients who are on medications, when we start looking back at, well, what symptoms do they have? And you look at what the side effects are of the medications, it's literally the side effects caused by the medications. And then when I start helping them kind of piece together, well, when did your symptoms start? It always starts after a vaccine or after they started taking the prescriptions. And whatever issue they had first come with doesn't necessarily get better. Sometimes it gets masked, but then all of the other side effects of that condition get worse. For example, if people take blood pressure medications down the road, now they start developing heart disease. And then they have, issues with urinating, and they are peeing at night, or then they have an enlarged prostate, or now they've developed a tumor in their prostate, or they have some kind of, bladder cancer, or they have edema and inflammation in their legs, and they've, they're retaining water. And now next thing you know, for those who've been on them for longer, next thing you know, they're on dialysis. So it's like this snowball effect that medications oftentimes, I'm not going to say always, but oftentimes mask symptoms, but then create more problems down the road. So after 10 years of working for a major academic hospital, it was interesting because I would see that some of the best doctors were under threat of having their departments closed. I remember this one particular client I had whose child had leukemia. The leukemia was now gone. The child was in remission, in other words, because I think that's a word for saying, well, we can't detect it, right? And so she, in my perspective, was cancer-free, but at the end of the day, the mother was being threatened that she needed to choose between another round of chemotherapy and doing some kind of transplant. Wow. And so the transplant, the mother was an epidemiologist. She was, a very educated woman. She realized and knew and had done the research to show that that particular type of transplant had a very high percentage of fatalities. Wow. So she didn't want to do the transplant. And so she was stuck with needing to do another round of chemotherapy for her child, who was doing really well and thriving. Now, my understanding was that if the mother didn't choose one or the other, she was being called by social workers under threat that the child would be removed. In cases of cancer, if the parents do not agree to chemotherapy or the recommendations of the doctors, typically the chemotherapy, then there have been cases in which children have been removed from the family and taken into custody. And so it's really scary that that choice of health practice or the path that you want to provide for your children sometimes is removed, is taken from you, right?
Yes.
And so in the same way, doctors are being threatened that if they don't produce enough surgeries, vaccines, prescriptions, that they're also under fire or under threat of having funding being canceled or being closed. And this is reality for many physicians, especially in the larger institutions.
Yes, it is. And we as patients who are consumers of their product, of that system, go into the office and we're relying on their medical support, supervision, and guidance. And with the vaccine issue alone, we're all hearing now through Senate hearings, look, there's all these vaccines that are given on the childhood vaccine schedule. And, good, bad, and in between, preservatives and all kinds of things that might not be great with vaccines, of course, to begin with. However, at the root level of the vaccine schedule, there's been zero testing of how these vaccines work with each other when given in combination and with multiple populations of kids from whatever background. It's just, there's a blanket, protocol that's provided with no, provision for individual health needs. Again, the contraindications of working with different, not just vaccines, but different medications, coming back to what you were saying. And even worse, some doctors don't talk to each other or collaborate with each other. So one specialist doesn't know what the other one's doing or prescribing or recommending. And as patients, we're all caught in the middle of that, wondering where do we turn? It's very difficult, especially given that prescriptions are, as you say, they're working on these symptoms and they're masking underlying issues. And it's a different rabbit hole is while some medications can be, of course, life-saving if given in a specific circumstance for a specific person for a specific amount of time, we should also look at that underlying root level of where are these symptoms coming from? Once the emergency's passed, how do I begin treating the mind, body, energy, my environment? How do I work at that root level to identify where that was coming from to begin with, to prevent that from coming back again? How do I avoid side effects from medications that are taken long term? How do I avoid being misdiagnosed by my doctor and misprescribed medicines that I may not need in the first place? This happens as you've seen probably in the hospital. And I see as a physician working in functional holistic medicine, I'm a primary care provider. People come to me as they would their family doctor, but they're looking for something that's holistic or whole person, in its orientation, not just conventional medicine, which we orient them to as well, but they're looking for something a little bit different. One, they bring in their diagnostic test results and they say, everything's fine. My doctor said everything is fine. And is it fine or is it awesome? Many doctors settle for okay, because everything's in the green doesn't mean it's optimal. There might be markers that show up out of range or just borderline, but it's still in the red. And doctors make a decision based on what they're seeing there. And they're just looking at that and saying, well, this is out of range. Your cholesterol is high. Well, is it really high, or is the ratio of these cholesterols, is the ratio okay? We need cholesterol. What about inflammation? What about some of the driving factors that are behind that cholesterol marker that they're looking at? They don't run the specific panels that they need to run, none of which are exotic. You can get these from a holistic physician, but any of your local labs will run these tests, but they're not routinely given. So the doctors have just a small piece of information to work from, and they make all their decisions based on that one piece. And it's not the full picture. This Absolutely. Is a big problem in healthcare too. And I think this also erodes our sense of trust in the medical establishment or conventional medical establishment.
When you look at forensics and you see that they're able to capture the exact cause of death with all the bells and whistles, everything that was in the human body, because they're doing, nail, hair, saliva samples. There's a way that medicine can capture so much detail as to what's going on with the human body. And they're stuck on blood work, and they're stuck on exams like the MRI with radiated iodine or x-rays or ultrasounds, all of which are toxic to the body, instead of doing thermography that is much more effective in being able to even predict future issues. And yet they're not covered by the insurance companies. So therefore they're not recommended by doctors, and they're not being used in hospitals and certainly in clinics. But if we did, I agree, if we did better testing, then doctors would really have a better picture of what's going on with the human body. And unfortunately, as you were saying, when doctors overprescribe, the amount of clients that I see that in which the doctors are recommending that they take certain medications and writing prescriptions like it's candy. And then I ask them, well, do you have high blood pressure? No, but the doctor just gave me a prescription. Do you have high cholesterol? No, but the doctor told me to take these pills. Well, do you have antacid? No, but the doctor said that I should take it for preventive purposes. And all of these are highly toxic medications that can cause serious conditions.
Yes.
Right?
Yes.
And so my question to you would be, what should a patient do in terms of what kind of conversation should they be having with their physician in order to be much more engaged and proactive? Because oftentimes people just they believe doctors like they're gods, and they think that they have all the answers. And as you were saying, they know nothing about nutrition. They don't get trained in nutrition. And when they start recommending supplements, I'm baffled, because I'm like, why are we recommending calcium? And why are we, I mean, there's so many things that they're recommending, and that they're pharmaceuticals, right? Prescribed from a pharmaceutical company. Mm-hmm. And they're doing no benefit to the patient whatsoever. How can patients be much more engaged and involved in their healthcare?
That's a fantastic question. That's sort of the $1 million question these days. And I coach my own clients in this and in other ways to work with their healthcare providers, because many people they've seen physicians that they have trusted for a long time, or they have some confidence in, they rely on them. And it's not so easy to find another physician, although there is something to be said for getting a second or even a third opinion. Don't stay married to your physicians or therapist just because that you've had a lot of water pass under the bridge. Doesn't mean you have to stay with them. However, if a doctor seems best intended and they're giving you their best advice, and they seem legitimately concerned for your health care, they're going to give you typically some prescriptions to manage those symptoms that you're presenting in the office, because the protocol, they have to. But ask them this question, and you may have to catch them in kind of a private moment, because there may be a nurse or a medical assistant who's there taking notes. And what I'm about to share with you, it cannot go into their record. You have to get them in a private moment as they're about to walk out the door, maybe, and say, oh, one more thing, doc, I appreciate all that you've recommended, but is there anything else that you can share with me off the record that we haven't talked about? Anything from your own research, things you'd tell your friends, your family, things that you'd find interesting, things that might be more wellness oriented that I could do on my own to prevent this from coming back again. But you have to couch it in that off the record, because if it's not written down, it technically didn't happen. And the medical supervisors, auditors for insurance companies won't know that you've had that conversation. The doctors might feel at liberty to say something that could be helpful in that way, or they might truly be doing research that takes them into a functional space, but they don't know how to share that with their clients or their patients. And so they're vulnerable enough to do so. Or again, they would say things to their family that they wouldn't say to you, perhaps, unless they're given a moment to do that in, a discreet or a candid moment, again, off the record. It might be a way to get that conversation started, even if it's an extra 60 seconds that you spend with that person. They might share with you something legitimately helpful from the natural medicine, holistic, or wellness space. Even as they write their prescriptions, there could be something else that they want to say, but they either feel they can't or they just don't.
Having worked in a hospital environment, I had one of my colleagues was a pediatrician, and he was my pediatrician. And so he didn't prescribe antibiotics for my son's ear infection. This was his first ear infection when he had started swimming. And so I said to him in the hallway, I said, where's my prescription for antibiotic? And he whispered to me so the receptionist wouldn't hear, they don't work. And I was baffled. And my mom is a nurse. We did antibiotics our whole childhood lives. She was big on antibiotics. And so for him to say that to me in a whisper, and then I looked at him because I trusted him. I do, he's wonderful. He said to me, he's like, they don't work. And I said, well, then what do I do? And he said, give him equal parts alcohol to vinegar in a dropper, put 2 drops and 2 drops. In 3 days, it'll go away. It's an antifungal, an antibiotic, it's an something or other. And sure enough, I said, and if your son continues to swim, make sure he has 2 drops in his ears when he gets out of the pool. Well, my son is a swimmer. He swam through college. He coaches swimming. He swims all the time. He's never had another ear infection in 26 years.
Wow.
So, I owe that to that doctor who was willing to be transparent with me in the hallway, as you just described. Same pediatrician, when my child was just a month or so, and we were going in for our first round of vaccines or our second round of vaccines. And he said to me, because I asked him point blank, as colleagues, as friends, I said, I've been doing a lot of reading books that say that vaccines cause all these spectrum issues, but then I'm reading the academic literature, and the academic literature says that there's no relationship. I said, what's the truth here? And he did a lot of research. That was his main role, was to research in pediatrics. And he said to me, he's like, the truth is that most of the studies are flawed. They're sponsored.
Mm-hmm.
And the very few good studies that he was able to find at the time showed that that vaccines caused childhood cancer, that they were linked to childhood leukemia, childhood diabetes, to sudden infant death syndrome, which is now finally coming out. Right now, they're going to start having medical examiners ask when a child dies from SIDS if they were vaccinated when they were vaccinated, because of that link between vaccines and sudden death. So even back then, I had that information. I also had my hands tied because schools didn't give us waivers at that time. Now parents have these opportunities to have waivers and ask questions, and we have the internet, and we have social media. We've got so much at our fingertips to be able to get more information. Just because a doctor says something doesn't mean it's what's right for you.
Yes, because we had similar concerns. And we know about preservatives, and we have been looking into it. I myself, this is maybe a different conversation. I grew up with natural medicine. I was a kid with ADHD, and I was never medicated. I grew up with diet. I grew up with exercise. Those were my those are my medicines. We learn on this issue, there are single-dose vaccines. Single-dose vaccines, they don't have the preservatives. The mercury, the aluminum, they don't have the preservatives that multiple-dose vaccines have. So if you have to get vaccines, there are ways to work around that so that it's relatively safer, and still to pick and choose, to get waivers when you can, to do your own research, because the doctors, as well-intended as they may be, they don't have all the information. Quick aside, I work with a patient who came in with a lot of digestive pain, a lot of intestinal pain, abdominal pain, and she had seen 3 different GI doctors before coming into our center, the specialists in digestive issues. And one doctor said it was her gallbladder. We have to take your gallbladder out. Another doctor said it was diverticulitis. There was infections, inflammation in her intestines. None of them tested for Candida. Candida is a very ordinary fungus that everybody has in and on their body. It's a digestive thing, mostly. None of them tested for it. We ran a test. Sure enough, she had extremely high levels of Candida. We eliminated that fungus from her system, did some other kinds of support. Her symptoms went away. She keeps her gallbladder. She's not threatened with extensive courses of antibiotics and steroids. And this is the specialists that are dropping the ball there. And again, back to my first point, they're not exotic tests. They're very straightforward. They're not being ordered. And physicians, they don't have time. They don't have training. They don't have the full story. And even if they're best intended, their hands are tied. So we have to advocate for ourselves as consumers, as patients and clients of those doctors who maybe we enjoy working with otherwise, but don't take their word for it. Get a second opinion, do some research, dive into it. Trust your intuition about what feels right for you and for your family.
Thank you so much, Dr. Newman. I celebrate the work that you are doing. It's really that fusion of the, conventional with the holistic, and ultimately keeping your patients' and clients' interests at heart first, not the insurance companies, not the protocols, not the institution, but truly your patient's care first, which I believe, that's what the Hippocratic Oath originally intended, for us to do no harm. So
Yes.
thank you so much. And how can people reach you?
Stepanian Holistic is a boutique holistic healthcare center, integrated healthcare center in South Florida. You can email me through our website or contact me there. As Gaya mentioned, there is a free consultation if you want to know more. Phone, Zoom. There's no obligation to come in or to work virtually with me if you're out of state or out of the country. Just reach out. I'm here to guide and support in any way that I can.